of toxoplasmosis. A life cycle of toxoplasmosis يبقى a life cycle of toxoplasmosis has two life cycle. Life cycle in the definitive host, which is the cat. It is present it occurs in the intestine, so it's called enteric cycle. The life cycle, the other life cycle occurs in the intermediate host, which is the mammal, including the man and the bird. It present outside, or it occurs outside the intestine, so it is exoenteric cycle. A life cycle in the cat, which is enteric cycle, it starts by ingestion of mature sporulated oocyst containing sporozoid, or ingestion of cyst containing bradiozoid, or ingestion of pseudocyst containing tachyzoid. Each one of this structure, mature oocyst, cyst or pseudocyst, rupture in the intestine and release its content, whether bradiozoid, whether tachyzoid, whether sporozoid. If any of this structure enter into the epithelial cell of the intestine and start asexual cycle, and then after الasexual cycle it start sexual cycle. يبقى في alternation of cycle, asexual cycle followed by sexual cycle and by formation of oocyst. Oocyst is immature oocyst descend in the cat feces. يبقى immature oocyst at the end stage of the Toxoplasma gondii in the definitive host, which is the cat. And the cycle in the cat, asexual and sexual cycle. After that, oocyst descend in the soil, it go to the external environment, and the sporogenic cycle or sporogony occur. It occur in soil, where the oocyst is go to maturation and produce or form a mature sporulated oocyst. This process take about minimum 1 day, and then maximum for 1 week, 10 days or 2 weeks. So we must dispose the cat feces immediately every day, not leave more than that. يبقى two cycle, definitive host اللي هو الكات, الانتريك cycle, asexual and sexual cycle occur end by formation of immature oocyst. Then the maturation of oocyst occur in soil by processes called sporogony. A life cycle in the definitive host, which is the man, is the exoenteric cycle. The exoenteric cycle in the man, it starts by ingestion of oocyst or by ingestion of cyst. In the intestine of the man, the oocyst release the sporozoid, its content, which is a sporozoid, and the cyst release its content, which is the bradiozoid, in the intestine of the man. Then the sporozoid or bradiozoid penetrates the epithelial cell of the intestine. It enters inside the epithelial cell of the intestine because the toxoplasma is obligatory intracellular parasite. Inside the intestinal epithelial cell, it changes into tachyzoid. This is the end stage formed by Toxoplasma gondii in the intestine. The tachyzoid is not, our Toxoplasma gondii is not an enteric, not enteric. It's present inside the man outside the intestine. So a tachyzoid penetrates the wall of the intestine, pass through the blood and the lymphatic into any nucleated living cell of the body. Inside the cell, it starts multiplication. The multiplication occurs by asexual reproduction. Asexual reproduction here is occurred by process called endodiogony. In the endodiogony, inside the mother cell, two daughter tachyzoid is formed inside the mother cell. Then it divides, and so everyone become two and so on. يبقى endodiogony is a type of the asexual reproduction occur only in case of Toxoplasma gondii, where inside the mother cell two daughter cell is formed, then it is divided and so on. By this way, the tachyzoid of Toxoplasma multiply inside the cell. After the Toxoplasma feeding the cell for hundreds or thousands of tachyzoid inside the cell rupture and the tachyzoid release to invade another cell and so on and so on. If the female is pregnant, the tachyzoid can pass through the placental barrier and reach to the fetus, where it causes congenital toxoplasmosis. Later, when the immune system of the host develops, the tachyzoid it changes into bradiozoid, and cyst wall is formed around it, where so the tachyzoid changes into cyst containing the bradiozoid. The cyst is the dormant stage, is present inside the host for whole life. So it is the end stage inside the human, or inside the intermediate host is the cyst. There is no portal of exit in case of Toxoplasma gondii. السيست او اي parasitic stage can't pass through blood, through urine, through feces, through whatever. So it is man هنا act as a blind host for Toxoplasma gondii. يبقى اللايف سايكل in man is exoenteric cycle start بالoocyst او bradyzoid. It change in the into tachyzoid in the intestinal cell of the human, and then the tachyzoid penetrate the wall of the intestine, pass through the blood or lymphatic to any nucleated cell in the body, divided asexually by endodiogony, and then the cell rupture, release the tachyzoid again and invade another cell, and so on until the immunity is formed. It change into bradyzoid, and the cyst wall is formed around it. Susceptibility to Toxoplasma gondii in general, anyone can susceptible to infection by Toxoplasma gondii, and when it go to infection, immunity is easily acquired, but the infection usually is symptomatic. Immunity against Toxoplasma either humoral immunity or cell-mediated immunity. Humoral immunity by formation of antibodies. Antibodies usually persist for year or for life of the host, protect the host against reinfection. Patient اللي هو immune suppressed patient by any cause, whether malignancy, whether taking drug, cytotoxic drug, or AIDS patient, and so on. At high risk has this person or immune suppressed patient are at high risk, but not of the infection as it is, but at high risk of developing what's called reactivated infection. Reactivation occur mainly in the immune suppressed patient. The pathogenesis and the pathology of Toxoplasma gondii, severity of infection against Toxoplasma gondii in the Toxoplasma gondii depend on different factors like strain virulence, host susceptibility, tissue tropism, and the immune privilege of the eye and central nervous system. السترين virulence في certain strain or some strain of Toxoplasma highly virulent. Toxoplasma in this case or tachyzoid highly proliferative, rapidly dividing, and it may produce severe pathology, may be fatal. Another strain may be less virulent or virulent at all, and from the start it go to form cyst and produce subclinical or clinical or chronic infection. And also susceptibility to infection, as we said before, it is general. Tissue tropism, Toxoplasma gondii prefer certain type of tissue to replicate and invade by it. Is like a cell of reticuloendothelial system, but it can be occur in any nucleated cell. But during the acute stage, it prefer usually a cell of reticuloendothelial system. The tissue tropism is a change during life cycle of Toxoplasma or during the stage of infection by Toxoplasma. In the chronic stage, it prefer another side, which is the immune privileged side, like the central nervous system, the brain, the muscle, the eye, and also the muscle. What is the immunoprivilege? Why it prefers this side? And this side is immunoprivileged side. It is hidden from the immune system of the host. So Toxoplasma or cyst of Toxoplasma can persist inside them for whole life of the host without any attacking by the immune host of the immune system of the host. So it protects themselves by this way, by presence inside this immunoprivileged side. This side, like the eye or central nervous system, helping them to be immunoprivileged is the presence of physical barrier around it, which interfere with the passage of antigen. But if the antigen is present inside it, this structure have the very specialized or highly specialized function, and also there is no renewal in this structure. So it must protect themselves by this way, by hidden from to be hide from the immune system. But if this system is failed by any thing, it can produce irreversible damage and can lead to loss of function of this organ, like the eye. It can be lead to loss of sight. But this is the factor affect the severity of infection, the virulence of the strain, its susceptibility of the host, the tissue tropism, and the immune privilege of the eye and central nervous system. What is the pathogenesis of Toxoplasma gondii? The pathogenesis of Toxoplasma gondii differ in the immunocompetent and the immunosuppressed patient. In case of immunocompetent individual with an intact immune system, In the acute infection, a tachyzoid proliferate inside the cell, as we said before, multiply by asexual reproduction, then rupture cell and reinvade another cell and so on. This produce necrotic foci surrounded by cellular reaction inside the organ, mainly lymph node. It produce necrotic foci surrounded by cellular reaction. Then the host immune system start to respond to to develop against toxoplasma. This immune system control the proliferation of tachyzoid. It change the tachyzoid into bradyzoid. Then tissue cyst is formed around the bradyzoid, and this it become inside the brain, inside the muscle. It protected from the host immune system, has no cellular reaction, no inflammation around it, and the infection become chronic, and it can be still dormant in the host for the whole life of the host. If the host is go to immunosuppression by any cause, there is something happen. What is this? What happened? The bradyzoid rechange again into tachyzoid, and this is called reactivation. If the patient have chronic infection with toxoplasmosis and go to immunosuppression by any cause, the bradyzoid start to release and change into tachyzoid, which proliferate rapidly and invade this different cell, progressive invasion, which can be led to death. It is a fatal disease in this case of immunosuppression. Immunosuppression, if from the start, immunosuppression infected by toxoplasmosis from the start, toxoplasma infected immunosuppressed the patient from the start by acute infection. In this case, this process is not occur, and the tachyzoid is go to proliferation and division rapidly, and also this is have a fatal end. But in immunosuppression has two scenarios. The first one, in infection by Toxoplasma gondii from the start, or patient immunosuppression led to proliferation of tachyzoid, not a change into cyst, because no immune system help the transformation or control the proliferation of tachyzoid, and in this case it proliferate all over the body and it can be fatal. Another scenario, when the patient is chronically infected with toxoplasmosis and go to immunosuppression by any cause. In this case, bradyzoid change in tachyzoid and reactivation occur, which also led to proliferation of tachyzoid, and it can be fatal also. The diagnosis of toxoplasmosis depends mainly on the laboratory diagnosis. The medical diagnosis